Hi, I'm Daniel Zakowski, CEO and co-founder of Ready Set Food, and I'm really excited that we're here to talk to you about the new educational partnership between Advocate Aurora Health System and Ready Set Food. We're excited to help make sure that all of the 36,000 plus babies born every single year at Advocate Aurora have access to the best food allergy prevention education, especially now that there's brand new USDA dietary guideline report that recommends that all babies eat peanut and egg to help prevent food allergies. So we'll get into more of those details shortly, and I think we're really excited to have real experts on this topic here to talk to you about it. So we have Dr. Jonathan Spergel, who's the head of allergy at Children's Hospital Philadelphia, and helped develop a lot of the educational material that we'll be implementing at Advocate Aurora shortly. And Dr. Shelly Waters, who's the lead allergist on the Aurora side, and she's really helped us make sure that all the educational content is exactly what we'd feel comfortable giving to patients, and not just done in a way that only doctors can understand, but also done in a way that will really be helpful to parents in helping prevent food allergies for their babies. And lastly, but not least, we have Dr. Katie Marks-Kogan, who's a private practice allergist in Los Angeles, California, and also the chief allergist of Ready Set Food. And she helped design and develop Ready Set Food to be evidence-based. And I do want to mention it before we get into as much of the science or the details, that we do have a product, but the main goal for our relationship is about education. That all of the educational material that we'll be presenting and using now is going to be brand agnostic, because our goal is that every parent knows that they need to feed their baby allergenic foods to help prevent food allergies. And we are a company, so we'll tell you about why our product helps make that easy. But that our goal is really education and making sure that every baby has the best chance at a life free of food allergies. So that being said, just giving you a quick overview, and then we'll let Dr. Spergel take over. So first we'll have Dr. Spergel go over some of the food allergy trends and risk factors that help show us why this needs to be a solution that every parent takes seriously. And then he'll go into more of the clinical trials that show that we can prevent up to 80% of these severe food allergies, and some of the new medical guidelines from the American Academy of Pediatrics, from the National Institute of Health, but even more recently from the USDA, now showing that we should be feeding babies allergens to help prevent food allergies. Then Dr. Waters will go more into detail on the food allergy prevention plan at Advocate Aurora, and how we'll be working to help implement those guidelines as best as possible in a way that's easy for providers and also going to be effective for parents. And then as we wrap up, Dr. Marks-Kogan will touch on Ready Set Food, why we developed it the way we did, how it works, and how that folds in as an important part of our mission to help prevent as many babies from getting food allergies as possible. So thank you so much for taking the time to watch this webinar. We know that if every parent followed the best practices from food allergy prevention, there's hundreds of thousands of babies that could be prevented from developing food allergies. So thank you for taking the time to learn about it and help spread that education to make that possible. Dr. Spergel, do you want to take it away?
Thank you, Daniel. So I'm happy to talk about this. And food allergies, as you probably know, are relatively common. It's almost in most elementary schools, 1 to 2 kids in a classroom. If you sort of go on a nationwide level, it's actually 32 million Americans, which is a huge number. And we know right now, I'll talk a little bit about it, but there's no cure. We have things that maybe make you less allergic, but nothing really cures. And most allergies, particularly in children, are peanut, milk, and egg. That really accounts for about 80% of children. So that's and you think about that's 1 out of every 12. So most children, that's probably 2 or 3 children. Next slide. So we do also know that food allergies are more common. If you look at over the last 20 to 30 years, food allergies have really risen. They've doubled and tripled, right? Particularly for peanut allergy, but in general, they've really increased a lot. The prevalence now is about 8 to 10%, which is unfortunately relatively common. And this is just that one slide looking at increases in number of emergency room visits, which gone up dramatically over the last several years, and it's gone up basically 150%, which is sort of frightening. We need to understand why that's happening, why food allergies becoming so common, and why so many kids go into the ER. And food allergy, as Gina Rosenblum has said, is this invisible disability that people don't know. You look like normal kids, but you really have something. So the goal really is how do we can prevent this, what we can do to prevent. So next slide, please. As I said, what can we prevent? Because there's no cure, right? We know there's problems, particularly at birthday parties. What can they eat? They need to bring their own foods to school events. A lot of kids get bullied for food allergies. Unfortunately, I knew a kid who actually ended up having to be institutionalized because he had so much bullying. It is really frightening. And the cost of having a food elimination diet can be very expensive. There's testing, as medications, all leads to major problems. And right now, our only real advice is avoidance. You give epinephrine for treatment of allergic reaction. That's the classic EpiPen, but there are lots of devices out there. There's now 4 different devices out, but you need to use epinephrine. What the palforzia, which is this thing that was recently approved by the FDA, is to desensitize. And I need to explain differently between what desensitize and what cure are. Desensitize makes you less allergic. That means you can't go home and eat a peanut butter and jelly sandwich, but the goal is if you ate a cookie with peanut by mistake, you would have a less severe reaction. And immunotherapy doesn't work for everyone, and every single study that's been done, whether it's for peanut, milk, egg, wheat, multi-food, we personally have done many of them. They work about 70% of the time. Unfortunately, about 10% get anaphylaxis, so it's not a benign therapy. It's great for those 70% that are less allergic, but they're not cured. They still need to carry that epinephrine device. So what we want is to prevent. That is the goal of, as a pediatrician, as a physician, I'd rather prevent disease. So that's what we really want to do. We know anaphylaxis is relatively common. Unfortunately, it does cause about 150 deaths. Compared to lots of other things we see in medicine, that's actually pretty low, much less than car accidents and gun violence and lots of other terrible things out there. But it is it's a preventable thing, and we should really prevent it. Next slide, please. So what are the risk factors? What do we worry about? Who should we concentrate more on? Unfortunately, we don't know who really is. We know some risk factors, but anyone really can have it. Having the certain risk factors does increase your risk. So eczema is the one that we really know really well. The more severe your eczema increases the risk. For patients with mild to moderate eczema, it's a maybe up to about a third. The severe goes up even higher. So they are increased risk for getting it. The average other increased risk, there's a family history. So there's a family history of eczema, family history of food allergy. That's another risk factor as well. So you need to work on those patients, but as well as any patient, because the average risk is 1 in 12. So better we can prevent, the better it is. Next slide, please. So what can we do? And this is sort of goes back in time. I'm going to take a step back before these interesting studies. Back about 20 years ago, we gave people really bad advice. We told people to avoid food allergy. And that was really based on the idea that was, we're getting things that they're allergic to. Maybe we give it less likely they'll outgrow it. They never will get it. But there was never really any evidence for this. It was just based on a few physicians' best guess. So there's never been any study that ever proved that food avoidance worked. Every single study, prospective and retrospective, all shown that giving the food makes you less likely to get food allergy. So there have been 3 large fundamental studies that really has changed our guidelines. The first one was the LEAP study, where they looked at children who were at risk. So these are children who had mild to moderate eczema or egg allergy, and they gave them peanut early on. They gave peanut in large quantities, and they basically had an 81% reduction in peanut allergy. Then there was the EAT study, where they tried to give multiple foods at the same time. That was milk, egg, and peanut, and they gave it to non-risk children. And in the patients who were able to do it, they had about a 2/3 reduction. Again, great reduction. The problem with this study, most patients could not take the amount of food because it was a lot of food, and they had trouble incorporating into the diet. Then there was the PEAT study, again, doing egg. Again, they saw the same thing, about an 80% reduction by giving eggs early on. So the earlier we can give food, in every single study, it makes a difference. And all these studies, whether it was patients who were formula fed, breastfed, they all started anywhere from 4 to about 10 months. And all the studies, the best window is about 4 to 6 months where you really want to start it. That's sort of that crucial window where you start it and can make a big difference. Next slide, please. So when they've looked at all of these studies, it's been interesting. There have been no severe allergic reactions in any of the studies, which is now over 2,000 infants. The other thing that's fascinating is breastfeeding and growth has not been impacted. People have looked pretty carefully at this. So they looked at the infants in the EAT study, looking at breastfeeding when they introduced it at 4 months, the breastfed babies who had placebo or who had basically breastfed babies who were given it compared to the control group. There was no difference in the amount of breastfeeding. They all grew the same. There have been other studies looking at breastfeeding on a retrospective status. Again, no difference whatsoever. And this also goes back to what advice we gave, what our grandparents and great-grandparents gave. They gave the food at 2 to 3 months, right? I mean, that's what was the guidelines way back when. When the kids can eat, you just gave the kid, and it really didn't affect breastfeeding. So breastfeeding is really important. It is great for nutritional reasons, cuts down infections, probably helps bonding, probably helps also well makes kids smarter, but it probably has no effect on food allergies, interestingly. But giving food early didn't cause people to breastfeed less, so it's something you can do without any problems. All these trials started about 4 months of age. That is pretty critical that we start soon. Does it have to be 4 months, 1 day? Nah, not really. It needs to be done early. It needs to be started. You need to do a substantial amount. It needs to be sustained. You need to take it every day, or at least 3 to 5 times a week. You really need to do it all the time. And we know from the EAT study, it was really hard. Compliance was poor. Most patients couldn't do it. So you really wanted to start early, give to the kid, and take it all the time. Next slide, please. So what do we know that doesn't make a difference? Avoidance has not. Avoidance actually makes things worse. Anything doing in the maternal diet, people have looked at avoiding foods during pregnancy, during breastfeeding, has made no difference. The use of hydrolyzed formulas has not had any good effect. We need to move our moisturizers up to what doesn't work. There have been 3 now large randomized clinical trials looking at moisturizers to see if it would reduce food allergy. It does not. There was one small pilot study that looked some benefit, but now when they did the larger randomized trials, it doesn't work. Vitamin D, again, probably doesn't affect things. Vitamin D is only really effective in Australia, where allergy is not a seasonal disease. Vitamin D is a seasonal disorder, so it probably doesn't play a role. Prebiotics and probiotics, we don't know. That one is, I have more hope for, but right now, the only thing we know that makes a difference is giving the kids the food. Next slide. So what does this all say? What does the guidelines say? So we can go back to the really old guidelines, and they said give it early. But then over the 80s, we said avoidance, that we went from 4 years to 2 years. Now all the guidelines over the last 5 years have really said give the foods early. And the guidelines have been pretty consistent, whether it's from the US, from the NIH, from the AAP, now from the US Department of Agriculture guidelines, which just came out a week or so ago. All these things say give foods early. It's important to give foods early to prevent food allergies, whether it's giving egg and peanut, as they mentioned specifically in the British guidelines. The NIH just talks about peanut. The AAP says basically no evidence to avoid foods. The new USADA guidelines say give peanut and egg. The Australian says peanut, milk, egg, and wheat. The World Allergy Organizations and the American Academy of Allergy and the Canadian Society of Allergy and American College of Allergy also coming out with new guidelines as well. Again, they're all going to say the same thing: give foods early. So basically, all scientific evidence says earlier is better. Next slide, please. This is the new guidelines, and you can see what it says. It just came out. It's hot off the presses. And basically it says giving peanut and egg starting as early as 4 months helps prevent food allergens. This basically brings the USDA and the FDA guidelines up to date with all the other allergy societies and the world organizations. It's not just peanut, but peanut and egg. So basically foods early definitely help. And this is part of now the new US guidelines. Next slide, please. So question is how to do it. We love weakened babies. We like the one in that upper picture. The kid eats so well, always happy, eating the foods on time. That wasn't my kid. My kid was the one more like that who wore their food. That's typically what they do. I do remember my kids eating foods at that age. They wearing their birthday cake was always a great photo. That first picture of the cake. So it's definitely, you want to make it easy as possible to get them in, whether it is helping them eat it or having them play with it themselves, but it is always a very cute picture when they wear their foods. Next slide. So the questions that people ask us all the time, why 4 to 6 months? Is that early enough? You probably can do it earlier. No one's really looked. Do you have to do it 4 months? That day? No, but you need to do it early. You need to do it sometime in that period of time, as you want to basically be exposed to the food, particularly the kids with eczema. This comes up the theory that we call the dual hypothesis theory, and we prove it in mice. I proved that in mice 20 years ago. Getting lac proved it in people, that when babies who have eczema, they expose through the skin, and that skin sensitizes you, so you really want to eat the food. How is too low bad? Probably not, but too low is not going to help. So you need to give it and give it on a sustained level. How long? The answer is we really don't know. We do think it's probably 6 months to a year, but a lot of these things, once you get on the diet, the kid just eats it. Like milk and egg, they're just taking it every day in the normal part of the diet. Introducing it for the baby who has allergies. If one kid has allergies, the other one doesn't. There's tricks. You can have a shelf. You can separate them out. You have to make sure they don't share. You don't stick the knife on one food into the other food. You can do it. It can be done. It can be done safely. So people also really worry about, is this safe? What about my baby having an allergic reaction? It's an important question, and on next slide, I think, yes, looks at that. So we've really looked at this. And we started doing this not because we wanted to look at what infants were, but we wanted to figure out who really was at risk for severe reactions. To me, that was one of the biggest questions out there. Who's at risk? Who do I have to worry about? So we did it in 2 ways. First, we actually asked for the food allergy deaths in infants, and we cannot find any deaths anywhere in the United States or in the Fatal Food Registry, which is run by Stacy Doris out of Vanderbilt. We asked FAIR, they don't know of anyone. I asked the folks in Britain. I had just got off the phone with the WAO, which is the World Organization. They don't have anyone. So we really, I'm sure there's some, but they're really rare. And when we started looking at risk factors, and there's a whole separate debate, what's a severe reaction? So, but any measure we could look at, whether it's sort of a physician's score, use of epinephrine, cardiovascular symptoms, we've looked, there's data looking at emergency room visits, which have been published. There's data out of large scale studies out of Europe. They all say the same thing. Babies, interestingly, have milder reactions than adults. And the kids that have, in terms of children, your reactions rate tend to go up as you get older. So teenagers and older children have more severe reactions, whether in a controlled situation as what we looked at in this abstract here, which was a food challenge, or even in the real world looking at like emergency room visits. So babies are safe, so you really do want to give the babies the food early if possible. And I will end my section of the talk and hand it off.
Awesome. Thank you very much, Dr. Spergel. That was extremely helpful and educational. And we're really excited to have Dr. Shelly Waters now talk about what that means and how we roll out an educational program at Advocate Aurora.
Thank you, Daniel, for asking me to be a part of this very exciting project. I want to point out that I think the statement on this slide is very exciting as well. If every parent at Advocate Aurora followed the food allergy prevention best practices, we could save 1,800 babies every year from developing severe food allergies. As Dr. Spergel mentioned, we as allergists frequently see the impact of food allergy not only on the child with the allergy, but as well as their families, including the cost of healthcare and the psychological issues that come along with the fear and anxiety of possibly having an allergic reaction. Most parents and even some physicians don't know that food allergy can be prevented. And even those parents that do know about food allergy prevention may struggle with how to safely introduce these proteins into their child's diet. So in order to move this mission forward at Advocate Aurora, we have put together educational content that will be added into the after visit summary. We've created epic dot phrases that address high-risk categories for food allergy, educational flyers for your office that have been approved by Advocate Aurora, and a coupon and giving back program through Ready Set Food that I'll discuss further. Additionally, we'll be doing educational webinars for physicians and RDs as this one today. Food allergy prevention recommendations have been added to the 2 and 4 week as well as 4, 6, and 9 month after visit summaries. The 2 and 4 week after visit editions highlight that breastfeeding moms should not limit their diets in an attempt to prevent food allergies. The 4 and 6 month old visits indicate that although breastfeeding provides all of the nutrition your baby needs at this age, it may not be enough to prevent food allergies. Studies have shown that regularly feeding babies foods that are allergenic, such as peanut, egg, and milk, starting at 4 to 6 months of age, may reduce their risk of getting a food allergy by up to 80%. The 9-month ABS also suggests fish as another allergenic food that the family may want to introduce. Additionally, we have created a series of dot phrases for high-risk kids. Dot Eczema Baby gives information on how eczema is associated with an increased risk of the development of food allergies and how early introduction can help reduce that risk. It also gives excellent recommendations for skincare in the child with atopic dermatitis. Dot Food Allergy Family is intended for families with a baby in which there is a family history of food allergy. It points out that a baby with food allergy amongst a sibling can have an increased risk for food allergy as high as 1 in 7, whereas the average is 1 in 12. It goes on to recommend early introduction of foods. Next slide, please. AAH is also providing an approved trifold that discusses general principles for food allergy prevention, risk factors for the development of food allergies, such as family history of food allergy and eczema, tips for feeding allergenic foods to infants at home, including commercially available products that are geared at helping make food allergy introduction simple and safe, and then an area of frequently asked questions and testimonials from allergists. Next slide, please. One of the available products, Ready Set Food, has made their prevention system free of charge for patients on food stamps, as well as for families whose parents have lost their jobs due to COVID-19. They are providing a tear-off voucher for pediatric offices, and the child's parent could also sign up for a complimentary 6-month food allergy prevention system through the website readysetfood.com/givingback. And now I would like to introduce Dr. Katie Marks Kogan, who will tell us about how the Ready Set Food program provides a safe and simple and economical way to prevent food allergy in babies.
Hi, everyone. Thank you so much, Dr. Waters. It's really an honor to be able to be involved in a webinar with both you and Dr. Spergel. So that's, it's really wonderful for me. And I love hearing both of your excitement about early allergen introduction. I share it as well. And I'm excited to be able to tell everyone at Advocate Aurora all about Ready Set Food and, you know, why we made it and how we made it. So before I get into that, I think the most important point that I always stress to my patients or whenever I'm giving talks on this topic is that you don't have to use a product to do early allergen introduction. The important thing is that you do it, right? We have so much evidence and we know that it's the right thing to do and that it can prevent food allergies. And so that's the most important point that we need to get across to families. Now, we know that that can be really hard to do. We know that it's hard to feed babies. We know that the studies showed poor compliance in terms of, you know, following a protocol because it's hard to feed babies and it's hard to feed them multiple foods multiple times a week. So that's why we created Ready Set Food in order to make this really easy for families to do. So there are some points that I want to highlight about Ready Set Food. And basically the main point is that it allows families to introduce peanut, egg, and milk through a bottle. So rather than waiting until baby is ready to eat solid foods and do it well so that it can be done consistently, we created a product that can be put into baby's bottle. It can mix with breast milk and mix with formula so that baby can get these allergenic foods really early on at the beginning of that window of opportunity. The other important point is that the amounts of food, the amounts of proteins that are in Ready Set Food are based on the clinical trials directly. So again, this product is, we wanted the product to be very evidence-based, and so the amounts of peanut, egg, and milk are taken exactly from the landmark clinical trials. We also created it so that each allergen can be introduced one at a time in a graded fashion. This is how we recommend that families introduce allergenic foods in general, and so we wanted Ready Set Food to be directly in line with that. The graded amount allows for a small amount to be given at first in case there is an allergic reaction. The smaller the amount at first, the less severe the reaction will be. And then doing a sequential introduction, so one at a time, allows you to know if there is any reaction, you know specifically which food it's to. And so that makes everything easier. Next slide, please. So this is a nice picture of the introductory stage 1 box for Ready Set Food. And basically, the stage 1 is a 15-day introduction where you start with a small amount and and build up. And you can actually see here in this photo the pictures on the packets tell you exactly what you're giving. So you don't have to reread the box if you want to know as a parent. So we try to make it really clear for parents to know what they're giving and each day. So we start with a very small amount of milk for 2 days, build up to a higher dose that's in line with the dose from the trials. Then we add egg, build up egg, peanut, and the higher dose of peanut. And then you go into stage 2, which is maintenance. And stage 2 is important, just as important as the introduction, because it allows parents to sustain exposure. So again, we know that introduction is very important, but we can't just introduce the allergenic foods once and then, not feed baby those foods for months and months, because they still can develop an allergy. We have to sustain exposure, and we have to feed these foods multiple times a week. And so with Ready Set Food, you do it daily in a bottle. You don't have to think and plan as much. And it makes it really easy for parents to do this. Another important thing to note is the amounts of milk, egg, and peanut that are the small amounts prior to building up to the maintenance dose are actually quite small. So for instance, for egg, the first exposure to egg is 1/250th of an egg, which is a lot smaller than most parents can even, give to their babies. So, so that's really important to think about. We're able to get this allergen into babies in a really small amount, again, to minimize a reaction if there were to be one. So that's really important. Next slide, please. So this is a picture of one of our main co-founders, Dr. Andy Leitner. This is his son and his daughter. His son, Abe, unfortunately, was diagnosed with multiple food allergies when he was very young. But fortunately, for Andy and for all of us and for, all the parents that will use the product, it was the motivation for Andy to think about, how could I have gotten these allergens into Abe earlier? And if I could have gotten them in earlier, would I have potentially been able to prevent these food allergies in my son? So that adorable face was the motivating factor for Ready Set Food. And all of the co-founders, we have actually all used this product on our children as well, which is really special to us. And then that other adorable baby in the picture is Abe's sister, Alana, who also used Ready Set Food. And she actually was at quite high risk of developing a food allergy. And to date, she is able to eat all allergenic foods without any issues. She has or had eczema, and then she also had a sibling with food allergy. So, again, high risk for developing food allergy, and she used Ready Set Food and is doing great. So it's been, a joy to talk about that motivation for, the creation of Ready Set Food. And so lastly, I just want to, thank everyone for listening. Thank Dr. Waters for really, helping us and spearheading all of this education and this partnership with Advocate Aurora. It's very special to us. Dr. Spergel, you've been amazing, as an advisor, as a guide. We appreciate all of your knowledge, all of your help with everything related to this. And it's really fun and exciting to think about ending this food allergy epidemic. So thanks so much.